So we did a phase 3 trial of low-dose tamoxifen in women with intraepithelial neoplasia of the breast, which includes atypical ductal hyperplasia, lobular or ductal carcinoma in situ. We randomized the women to 5 milligrams per day of tamoxifen for 3 years or placebo. We found a 52% reduction in the risk of recurrence in the tamoxifen arm, which includes invasive breast cancer or DCIS. And perhaps more importantly, we found a 75% reduction in the risk of contralateral breast cancer, which is based on small numbers, so you have to be cautious, but opens the door for the treatment of at-risk healthy women in the primary prevention setting. The 3 years of treatment was selected on the basis of the idea that these women with intraepithelial neoplasia are not at increased risk for metastasis in the first run. So we thought that 3 years could be a reasonable compromise because there's no data to show that in women with in situ disease, the longer is better. Regarding the dose, we did several pre-surgical trials or biomarkers trial showing that you can lower the dose with, while retaining the efficacy but lowering the side effects. I do think it's a practice-changing trial in the women with these at-risk disorders of the breast. I think that 5 milligrams per day, or cutting the 10 milligram tablet, because we don't have the 5 milligram in the market yet. So one can take 10 milligram every other day or cut the 10 milligram tablet. I think it's a new standard of care in women with breast intraepithelial neoplasia.